For many Nigerians, serious illnesses like kidney failure are still seen as a problem of old age and reckless living. But across hospitals and dialysis centers, that assumption is quietly breaking down. Now, kidney failure is increasingly affecting young Nigerians in their 20s and 30s, often diagnosed late when most kidney function have already been lost. In this report, Gist Nigeria's Sarah Ayeku examines why kidney disease is affecting younger Nigerians, the hidden lifestyle and medical triggers behind the surge, and the widening gap between government promises on dialysis and the realities patients face.
The beeps, ushering filtered blood back into the body. But
I'm not feeling comfortable at all. I've not been myself. I can't do anything.
She's in pain every day.
the pain, hours spent lying in bed, weakness and empty pockets are too much to bear. And once the money stops, life stops too.
Most people die just because they cannot be able to afford most of the treatment.
Experts say chronic kidney disease, also known as kidney failure, is a silent illness, damaging the kidneys slowly, often with little or no warning. By the time many people feel sick, their kidneys have already stopped working. Around the world, kidney disease affects about 1 in every 10 persons. In Nigeria, experts estimate that 25 billion people are living with the condition, many without knowing it.
It's a general term that the increase in prevalence has been noticed all over the world, and it has been projected that by the year 2050, the prevalence will be more than 1 billion people having chronic kidney disease. And as it is now, it's estimated to be about 850 million individuals living with chronic kidney disease worldwide.
Studies suggest that approximately 12 to 14% of Nigerians have evidence of chronic kidney disease. This means 1 in 8 persons in the minibus, including the driver, may already have chronic kidney disease. But the numbers vary across the country. The highest rates are in the northeast, around Borno and Yobe states, where about 1 in 4 people have the condition. At this renal care center in Maiduguri, capital of northeastern Nigeria's Borno state, the wards are brimming with patients and their families.
For these past 4 years, that's taken away all the finances I've gathered over the years.
John Moody is a taxi driver at the international airport in Abuja, the Nigerian capital. 9 years ago, his wife complained of exhaustion from walking short distances. Doctors diagnosed and treated her for hypertension and diabetes, but her condition worsened.
This is 3 years now I've been on dialysis. The doctor advised us that we should go on dialysis 2 times in a week, or we should go for kidney transplanting. So we cannot even afford once in a week, at times once in a month or once in 2 months.
And even more terrifying is an emerging trend. More young Nigerians between their 20s and 40s ending up on dialysis beds. Sarah Sohe never imagined kidney failure would define her life. At the tender age of 9, Sarah began having health problems.
I didn't understand the journey. I just thought it's a very easy journey. Just do it and come out of it. When I started going for dialysis, that was when I knew that this is life. That's when I knew that this is a serious matter.
At the age of 33, Oluwabumi Osekita was diagnosed with stage 4 chronic kidney disease in Southern Delta State. Medical advice to immediately start dialysis wasn't complied with initially. 1 year later, his family was plunged into pain.
We just thought it was malaria. Of course, went for tests, did all that, and it kept showing malaria typhoid until December 2024. So he went to another hospital, and that was when he had all the tests, like, a full blood count and all that. And that was when they suspected that something was wrong with his kidneys.
Doctors warned that everyday habits silently damage the kidneys. Painkillers bought over the counter, unregulated herbal mixtures, abuse of alcohol, energy drinks, and recreational drugs are all major triggers.
You have people who are artisans. They are farmers, they are carpenters, they are shoemenders. They move around. So because once you feel body pain, you just take in one pill of those pain medications. Now, these have significant impact on the kidney, and they are a major cause of our problems.
Then, there are also two silent killers, high blood pressure and diabetes, which experts say overwork the kidneys.
Hypertension prevalence is increasing, and the population affected or involved in this increase has also been noticed to be the young people between the age of 15 to 39. There seem to be more percentage of people coming up with hypertension compared to the past.
Dialysis isn't cheap. In private clinics, it can cost as much as 70,000 naira per session. Government hospitals charge between 30,000 and 40,000 naira. In 2025, Nigeria's federal government introduced an 80% dialysis subsidy, reducing costs to about 12,000 naira per session for indigent patients.
The National Hospital is very expensive there. And even the Federal Medical Center is expensive too.
GIST Nigeria reached out to the Chief Medical Director of FMC Jabi to confirm if the hospital is on subsidy list of the federal government. He replied our message saying, quote, "We're not yet on the subsidy program, but hoping to be included possibly this year," end quote. In Oyo State, the Oyo State Commissioner for Health says federal hospitals lack funds for dialysis consumables, and this has limited the implementation of the subsidy program in the state.
It was a trial, and it was supposed to be tested in 11 states. These institutions have not even started because of the logistics around the funding gaps there. For them to be able to secure the things that they will need, also maybe to put in place for them to say, okay, we want to be subsidizing the money for people that need dialysis.
However, GIST Nigeria can confirm that the subsidized dialysis scheme is operational at health facilities like the Federal Medical Center in Butemeta, Lagos.
We started the presidential dialysis program here in FMC on the 12th of December 2024. And since then, we've offered dialysis to over 1,000. We've had over 1,000 sessions here.
Dialysis keeps people alive, but it's not a cure. Survivors like Sarah are advocating for more voluntary donors to step up and help chronic kidney disease patients.
There is a need for us to spread this awareness. Instead of people are there selling their organs, why are you selling your organs? You can save humanity. I'm preaching humanity.
Across Nigeria, thousands are now tied to the machines because they were diagnosed too late. Doctors insist this outcome is often avoidable.
It's very, very cost-friendly to identify what you call kidney function level. You just do a basic blood test, and some of those tests are very, very affordable. You do a creatinine, you do a urinalysis, and a few other tests may be necessary as adjuncts, but these are the two critical tests.
In many Nigerian communities, the first response to illness is not the hospital, but traditional medicine.
When the thing is not used in moderation, it can damage kidney. But there is a way we use it as a herbal practitioner that will make sure that it doesn't affect the kidney, but instead it will just improve the kidney function.
Traditional medications, from my experience, make matters worse because these options are not evidence-based. They are basically anecdotal.
Experts say kidney disease is no longer a distant threat of old age. It is quietly reshaping the lives of young Nigerians, caught in short potential. As government policies promise relief, patients continue to navigate a fragile system where survival depends on access, affordability, and timing. The question now is, will action come early enough for those already waiting? Sarah Ayeku, Just Nigeria.